Hey everybody, Dr. Angela Casey with you today, board certified dermatologist. Thank you so much for joining us today. We're going to cover the topic of retinoids versus retinols today. I get a lot of questions from patients and they often use these terms interchangeably. I've also found that many practitioners will use them interchangeably. So let's talk about the differences and why a product that you can maybe get over the counter that has a retinol in it is significantly different from a prescription strength retinoid that you need to see a physician or practitioner to obtain that prescription for. So let's go ahead and dive in. So I just want to start with saying that if I had to pick one skincare product, if I could only have one product in the whole world to keep my skin healthy and rejuvenated and vibrant, it would be a retinoid. And let me review with you all the benefits that these amazing creams provide. First of all, they help strengthen and plump up the collagen in our skin, thereby reducing fine lines and wrinkles. They help even out pigmentation, so if you have freckly skin or pigment deposits and you're wanting to really clear and brighten your skin, a retinoid is going to help accomplish that. They regulate oil production in our skin, and they also help our skin slough off dead skin cells. And in doing that, it leads our skin to looking more brighter and more refreshed and rejuvenated. And in sloughing those dead skin cells, the retinoids also help unplug our pores, and through that mechanism, they help prevent acne lesions and blackheads. So I guess you could say that retinoids truly are our fountain of youth cream. And when we look at efficacy of skincare products, I always tell patients retinoids are way up here in terms of efficacy. And then down here, you've got your antioxidants. And then over here, all your peptides and growth factors and those other active ingredients that are in serums. But just remember, those retinoids really surpass all the other ingredients in terms of their clinical efficacy. And this has been studied in numerous clinical trials over many decades. And so what exactly are retinoids? They are actually vitamin A derivatives and come in a number of different forms, including retinaldehyde, retinoic acid, and retinol esters. So let's get into some more of the differences. And again, getting back to the idea of what separates a retinoid from a retinol. So retinoic acid is kind of the common theme that connects all retinoids and retinols, because that is the active form of that vitamin A derivative. And whether it's a retinoid such as tretinoin or tazarotene or adapalene, it's going to eventually be broken down into that retinoic acid. And same as a retinol. Retinol is just going to have to go through more steps to reach that active form of the retinoic acid. And in doing so, it becomes a little bit weaker as it continues to be broken down through that chain of metabolism. So you will see many over-the-counter products marketed as containing retinol. It will contain a retinol in an ester form that may be listed as retinol acetate or retinol palmitate. And again, this is still effective. It's better than not using any sort of retinoid or retinol on your skin. It's just important to understand that those over-the-counter retinols have to go through multiple steps to be broken down to that active form of the retinoic acid, whereas the prescription retinoids that I mentioned earlier get there much more efficiently. And as a result, the retinoids, which are prescription only, are much more potent and effective in your skin. The retinoids are the ones that have been really clinically proven in terms of all of those benefits of strengthening collagen in your skin, helping to regulate oil production, helping to slough the dead skin cells, and also regulating pigmentation. Although the retinols are still going to accomplish that, it's just going to be at a fraction of the efficacy that you're going to see with a retinoid. So over the years, I've seen a lot of patients, and I always discuss a retinoid or retinol as part of their skincare regimen, because again, I think it's a very fundamental element of your skincare routine. It's the one product that I think supersedes anything else in terms of its efficacy. I have so many patients that say, Dr. Casey, I cannot tolerate that. My skin is very sensitive. I'm not going to use it. I've tried one before and my skin gets dry, flaky, irritated, red, blah, 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 blah. And I always tell them, there are so many different formulations available of retinoids and retinols, so there truly is something for everyone. I firmly believe that, and it's just a matter of finding that one that works for your skin. Secondly, it is so important to make sure that you have the right supporting products, including a gentle cleanser and a really effective moisturizer that work hand in hand with that retinoid or retinol. If you're not moisturizing your skin enough, of course it's going to get dry and flaky when you apply the retinoid, and it's helping your skin shed all of those dead, dry, dull skin cells. Likewise, if you're using a really harsh cleanser, it's going to irritate your skin. So just be really cognizant of what's working with your skin. I don't have a strong preference for a moisturizer. I tell patients, really listen to your skin. If your skin's on the drier side, you want something nice and robust and thick and a little bit of a heavier consistency. If you're oilier, a lightweight, easily absorbing formulation for your moisturizer is going to be ideal. But just keep in mind the importance of those supporting products in ensuring the success of your retinoid or retinol. And if you do have the opportunity to ask your provider, whether it's your dermatologist or your primary care doctor, about a prescription for an effective retinoid, I usually recommend starting with tretinoin 0.025%. That's a great starting point, and working your way up. I use actually tretinoin 0.1%. That's what I use myself. I have some right here. Brand name is Retin A. And I use this almost nightly on my skin. I do find I get irritated from time to time. If so, I'll take a night or two off and then resume it. Another great option, if you can't get a prescription, is the Susan Obagi line Retinoids. This is a beautiful retinoid that has such a nice emollient quality to it. So you can see it's almost like it has a little bit of like a Vaseline type texture, but like a super lightweight, fluffy version of that, if you can imagine that. But this has really nice emollients that help hydrate your skin while delivering that active retinol ingredient that's going to help with the collagen production and pigmentation in your skin. So Susan Obagi Retinoids. Again, there's so many options on the market, so see what works well with your skin. I'll mention one other. I don't have a sample of it here, but it's Skin Better Science Alpha Ret, which actually combines an alpha hydroxy acid to help bring moisture into your skin and works as a humectant, along with the retinol within it. And that I found has been a great option for my patients with sensitive skin. So I hope this episode has helped you understand the differences between retinoids and retinols. I hope more than anything that you'll go out and be sure to get started on this, use it consistently. I promise your skin will see that cumulative benefit, and it truly is my #1 single most important skincare regimen element. Truly, if I had to pick one product, one cream out of everything that's on the market, this would be it. It is Retin A, also known as tretinoin. First of all, I just want to mention I've already washed my face. I've put on my moisturizer, and it's really important to have that moisturizer in place before applying your retinoid, because that moisturizer is going to kind of act as the foundation, keeping your skin really strong and hydrated and healthy, so that retinoid isn't too irritating to your skin. So after putting on your moisturizer, and I have that all over my face, neck, and chest, I'm going to take about a pea-sized amount of the tretinoin onto my index finger, as you can see here. And then I'm going to dab that. I usually dab it on 5 places on my face. That's just a habit I've been in for years and years. So cheeks, making sure to get all the way to the jawline. Tends to get a lot of sun damage in our lifetime, and also an area that tends to lose collagen. You can see I'm going to get it all the way to my lower eyelids, and it is safe to put it on that eyelid skin. You just don't want to get it into your eyes at all, of course. That's going to be irritating. And about once a week or so, I'll put a little bit on my neck and chest area. If you do it more than once a week, if you apply it more than once a week to your neck and chest area, it tends to be a little bit irritating, so you don't want to do that. Your goal is to work up to using tretinoin or your retinoid every night on your face if you can. If that produces too much irritation, you can back it down to every other night, every third night. I have some patients that use it just once a week. So see what works with your skin type and how your skin tolerates it. It never ceases to amaze me that one product can accomplish all of these tasks. So retinoids help build collagen in your skin, and we all want to keep that collagen really strong, healthy, vibrant, nice and thick. That's going to keep our skin looking youthful. Secondly, it evens out pigmentation. So I am a child of the 80s, and back in the first 2.5 decades of my life, I had more blistering sunburns than I can count. I tanned regularly. I used tanning beds. I was just always the freckly kid. I had tons of freckles all over my face and chest, everywhere. And as you can see, most of those freckles have disappeared at this point. And I credit a lot of that to using tretinoin or another retinoid really for the last 2 decades of my life. And of course, using really good regular sun protection. So that's when I was pregnant or breastfeeding, because it's not safe to use retinoids when you're pregnant or breastfeeding. So also will help regulate oil production in your skin. So really nice added benefit. And the final task that retinoids help accomplish, they help your skin slough dead skin cells from the surface. So that's going to remove a lot of that dullness and that dryness of your skin, and it's going to leave your skin looking like really vibrant, fresh, renewed. It's just going to help regenerate everything in your skin. I cannot wait for you to implement this into your own regimen and see the benefits. Just remember, it takes months to really see the full effects, so stick with it. Again, and be sure to share this with any friends or family members that will benefit from the information. Thank you so much for joining us in this episode, and we will look forward to seeing you next time.